rhythms, which are ventricular tachycardia and ventricular fibrillation. So if we use our 5-step method for all of these, we can see the differences. So for both of these, we have different regularities. So we'll start off with ventricular tachycardia. So regularity for VT is usually regular. It can be slightly irregular, but usually a regular rhythm. The rate usually can't be determined for the atrial rate, but the ventricular rate will be really fast, usually between 100 and 250 beats per minute. Now the difference between this and an SVT as well is this won't have a P wave. There may be like a P wave occasionally, but it won't be associated with any QRSs. It will just be a random P wave. There won't be any PR interval because there won't be any P waves. And another key feature of these is that the QRS complex will be very wide and abnormal looking, and it can actually be difficult to differentiate between the QRS complex and the T waves as well. As for ventricular fibrillation, these are very irregular. It kind of just looks like a big scribble on a piece of paper, and they can be very difficult to analyze as well. There won't be any waves really to be able to determine a rate at all. So for this reason, we definitely won't see any P waves or a PR interval or the QRS complexes. So we can say this can be coarse or fine VF. So if they're really large squiggles, we usually say this is coarse VF. And if they're little waves, we'll say this is fine VF. Now there is a type of ventricular tachycardia which looks like a VF, but it has sort of a pattern to it. I'll talk about them. I'll show you one later. But we call this torsades. So this is just a type of VT. This here is an example of ventricular tachycardia, and we can pretty much identify it straight away. But let's do this properly. So starting with our regularity, each little point here looks pretty regular. So straight away it's differentiated it from ventricular fibrillation. So we can count the rate of this as well. So I'm going to use the 1500 method because I can count how many small boxes. So we can use the points here or the points down here. So let's just use this one here. So let's just say this is one big box here, and so that's 5 little boxes, 6, 7, about 8 little boxes. So 1500 divided by 8 is 187.5. So let's just say this rhythm is approximately 190 beats per minute. So we can't see any P waves here. There's no PR interval, but these are actually QRS complexes, and they're wide and bizarre looking. So our interpretation of this rhythm would be ventricular tachycardia, example of ventricular fibrillation. And we can see this straight away because we can tell that our rhythm is completely irregular, and it's so chaotic, we don't know what's going on here. There's no way of interpreting the rate because we don't have any definitive waves at all, no P waves, no PR interval, no QRS complexes, nothing. So this is actually VF, and we say this is fine VF because the amplitude is quite low. If it was larger, it would be coarse VF. The strip here looks a bit bizarre. So let's just start off with the regularity. So we can see that it's quite regular. The rate is approximately 300, 150, let's just say close to 180 to 190 beats per minute. There isn't really any definitive P waves present, so there would be no PR interval as well. And the QRS complex here, this is a QRS complex. It's quite wide and bizarre here. So this actually meets all the criteria for ventricular tachycardia. So this is ventricular tachycardia at a rate of 180 beats per minute. Of torsades and what it looks like. So we can see here it starts off quite slow, gets bigger, smaller again, bigger. So it has this kind of wavy pattern to it. So this will always be torsades, not VT or VF, just torsades.